Today I'm going to take you through the 5-step treatment approach that we use at the Doctors of Physical Therapy to successfully treat back pain in over 90% of the cases that we see. Step number 1 is alignment. Okay, so if we are thinking about alignment, we're thinking about the skeletal system here. Okay, now your muscles attach a bone to a bone. So when we're talking about alignment, different things can happen with alignment, but let's say that there are two bones that a muscle attaches like this, and then one of those bones either rotates or turns. Well, that creates a little bit of slack in that muscle that holds those two bones where they are in relationship to each other. So now in order to stabilize whatever the skeleton is doing, that muscle has to contract a lot more, or neighboring muscles around that muscle have to overreact to do the things that that muscle is not doing. So that creates that situation in which somebody feels like all their other muscles are compensating all the time. So first you focus on the alignment, and then once you have that alignment good, then you move on to stability. So you activate the small muscles all around the spine right here and even the shoulder blades here to basically cinch that alignment in place, okay? And then you can focus on mobility. So mobility is where most people start. They'll either start going to the chiropractor or the massage therapist just because things feel stiff and they want to get that moved more. The problem is that if you start with mobility, you'll get stuck in this situation where people just keep going to the massage therapist or chiropractor, and you get relief for a few days, maybe even a few weeks, but the problem seems to just keep coming back because at the core you still have not addressed that stability or the alignment in the first place. Now, once you're aligned and once you're stabilized and once we've started to mobilize all those tissues, then you get to start integrating that into movement, whether you like lifting weights or yoga or running. Okay, once you've stabilized that skeleton, now it's much easier to know how to move using your stabilizers, and that's the 4th step. The 5th step, once you've started to move really well, is actually strengthening that structure. So you build the muscles around the skeletal system once it's in that good alignment to make sure that this does not continue to come back over and over again. So we're going to recap that. Okay, so first we align. Okay, that has to do with your skeletal system. Then you stabilize. This is where you're cinching up all the joints, basically making them stay aligned to each other by using the smallest muscles next to them. Then you get to move on to your mobility phase, okay? And then these last 3 steps kind of all happen at once. You're mobilizing the stuff that's stiff, you're moving so that your body starts to learn how to move with all of this stuff in the right place, and you're strengthening all at the same time. That's how at the Doctors of Physical Therapy, we help patients who have had back pain for 2 months, 5 years, 10 years, 25 years plus, actually get out of that chronic pain state and back to living the life that they want to live. So if that approach sounds like something that you have not tried yet, feel free to scroll through the rest of the page, see if the rest of the page is something that you think would help you decide that we might be the right fit for you. Feel free to fill out a contact form while you're there. Give us a call. Our front desk is always on standby, ready to answer any questions that you have, and we can offer you a free consultation, 30 minutes with a doctor of physical therapy. So with our back pain experts, we only offer 4 of those each week, so please do act decisively if you think that our 5-step approach might be right for you.